Dr. Paul here. I've got a baby with a goopy eye and something going on with the belly button. We'll go take a look. Hello. Hi guys. How you doing? So look at all that yellowish goop. Here we go. All right. Look at that eye. That's lovely. Lovely, lovely. So that amount of goop was just in the last hour. Parents had wiped that off completely an hour ago. Right? Yep. So that's pretty impressive. So pink eye in little babies is sometimes associated with ear infections. We've already looked. They're perfect. And we've checked out everything else. We've got nothing going on but just what you're seeing in that eye. So when it's this goopy this fast, it's almost always bacterial. Pink eye can be allergic if you're an older kid and you have allergies. Pink eye can also be viral, but when it's that goopy, it's bacterial. So it's a simple treatment of an antibiotic ointment. In this case, I'm going to use tobramycin, Tobrex. One can use erythromycin. That's what they usually use in the hospital for newborns. Let's get a little bit of that goop off.
Oh boy, that looks
Look at that. Cool. Much better. Sometimes you'll culture an eye because you want to identify the specific organism. I find that not to be necessary since 99.9% of the time, like always, they get better. So it's not a big scary thing. But I know new doctors, they want to know exactly what organism it is, so they'll send off a culture. We could, but I don't think we need to spend the money. If you're okay, we just treat it and it'll get better.
Sounds good to me.
Sounds good? All right. Well, there's a straightforward pink eye and a young one, 7 weeks old. So we've had a slight outie since birth, correct?
Yes.
So what we're seeing there is a little bulge right where the belly button is. And I can put my finger on that and kind of wiggle it around, and it's smaller than my fingertip. So what we're looking at, if we were to look at her tummy, let's see here. I bet when she cries, that bulge is up.
Yes.
Right?
Yeah.
It's possible that a loop of intestine can actually push through that opening, and then when you go like this, you feel that little squishy. Yep. That's the intestines going back into that little defect. And when right now, I would say if you look at her tummy sideways, the hole is, about that big, maybe a slight bit smaller. And when she cries, it's doing this, right? In a few months, that hole's going to be a lot smaller, but when she cries, it could do that. It could look even worse. And by the time she's in school, it'll be closed. It'll just be a little wiggle.
Okay.
It'll be a regular belly button. So this is an umbilical hernia. Hernia is when something in the body is protruding through a space that's normally closed. So if it's at the umbilicus, that's an umbilical hernia. The intestines are herniating through the little defect at the umbilicus. The other common place for hernia is inguinal. If guys have an inguinal hernia, for your sports physicals, you might have a bulge in intestines getting down into your scrotum. All right, thanks for watching. I'm Dr. Paul. Hey, it's Dr. Paul. Thanks for watching. I just want to remind you, I've got this book coming out, The Vaccine-Friendly Plan. Check out the information in the description. I hope you'll get this book. It can change the future for your children. Thanks for watching.